A very good morning and Jai Shri Krishna to all our viewers. This is Khyati Morparia on behalf of Team Drshtikon extending a warm welcome to all of you to the 28th webinar of Drshtikon Talks. We hope that you are taking all the measures to stay safe and healthy. At Drshtikon Talks, we bring to you eminent Bhartiya speakers and experts to share their knowledge and valuable experiences with us. For this, we conduct a live webinar of 1 hour or a conversation with experts of different fields to widen our knowledge base and increase awareness. Today, being the 28th session of Drshtikon Talks, we take this opportunity to thank you all for the continued patronage, and we hope to move ahead by imparting greater value to all of those who attend our webinars. As we want the webinar to be conducted smoothly, we request you all to post your questions in the chat box. Our moderator will take up the questions after the speaker completes the talk. Any unanswered questions will be answered by mail on a later date. Also, requesting all of you to switch off your mics and videos. Our speaker for today is Dr. Jatin Ashar. Requesting Meenal Ashar to introduce our speaker to you. Over to you, Meenal ji.
Thank you, Khyati. Jai Shri Krishna and a very good morning to everyone. Our guest speaker this morning, Dr. Jatin Ashar, is an ophthalmologist and eye surgeon by profession. He is the founder director at Mumbai Eye Care, a world-class tertiary center for cornea, cataract, and lasik services located in Ghatkopar, Mumbai. Dr. Ashar trained for his MD at the prestigious AIMS Institute and then went on to complete his Diplomate of National Board, Fellow of International Council of Ophthalmology from UK, and also Fellow All India Collegium of Ophthalmology. He has completed his fellowship at the L.B. Prasad Eye Institute, Hyderabad, and served as a consultant at the same institute. Dr. Ashar has contributed extensively to major journals of ophthalmology in the form of 19 index publications, 10 non-index publications, and 2 book chapters. He has to his credit over 200 international and national oral presentations and over 100 international and national posters in his field. His awards include the Prem Prakash Award for ORA quiz during residency, the T.P. Agarwal Trophy for Best Paper Presentation at DOS Best Poster Award in the years 2012 and 2013, International Ophthalmologist Education Award from American Academy of Ophthalmology in the year 2014, Achievement Award from American Academy of Ophthalmology in the year 2015, and most recently, the Kutch Ratna Award 2020. Dr. Ashar envisions to provide continual, excellent eye care to all by integration of most advanced technology and highly trained, skillful hands. I'm sure our audience today will be gaining extensive knowledge on eye care, which is so pertinent in recent times. From schools to offices, work to leisure, it's all our poor little eyes being subjected to the drain and strain. So without further delay, I welcome Dr. Jatin Ashar to kindly address this 28th webinar of Drshtikon Talks. Over to you, Dr. Ashar.
Jai Shri Krishna, a very good morning to all of you. And I thank the Drshtikon team for inviting me for this webinar. We all know that we have multiple senses in our body. Of all the various senses, eyes form the most important part. What we see is what we assimilate. And most importantly, this is what forms experiences for our lifetime. Extremely important for us is that we understand that this is an organ that we really need to take care of. This is an organ that develops right from birth and continues to be there with us, and we all need it even after we are born. A lot of people who are waiting for us to spread light in their life. So right from our birth till even after we leave for heavenly abode, this organ continues to be there with us and helps us see this beautiful creature that the God has made, helps us form experiences, helps us learn things, helps us understand what we are to do, and most importantly, keep ourselves safe. But a lot of times we keep neglecting and take this organ for granted. Today, I would be talking about eye care for all of us. I'll be discussing about various age groups and how would we be taking care of the eyes and various eye problems at these age groups. I'll be dividing my talk basically into 4 parts. The first part will be pertaining to eye care in small children. Then I'll be going to adults from 18 to 40 years of age. Then I'll be speaking about eye care issues with older individuals, say beyond 40 years of age. And I'll be touching upon how we want to spread light in others' eyes by eye donation and few things about eye donation, eye banking. After each part, we can take questions pertaining to that part. So if there are any questions, please feel free to put them in the chat box and I'll be discussing them right there and then. So first we'll be talking about various eye care issues pertaining to children. Most importantly, there are a lot of questions that parents have, that when is the right time to get the eyes checked for their children? What is the ideal screen time? What should be the good diet for their children? What is a lazy eye? What if the child has some problems in the eye? How do we diagnose them? And if diagnosed, what is it that we have to do further? So you have to understand that children are not mini adults. Their problems are different. The eyes are something that quickly keep changing as they grow. And most importantly, it is important that in order to have the child to be developing well, to have good learning, and to be able to assimilate things well in school or their overall learning, they have to have good eye care and good eye health. So it's important to have a good attention on child's eye health, and this helps us pick up problems early while the eyes are still being developed. So if you can pick these problems up in time, you can treat them early and most importantly, prevent permanent damage to their vision. So this starts right from conception. So if the parents are into habit of smoking or even passive smoking, these can affect the unborn child's eyes. Most importantly, if a child is a premature baby, then they are at a risk to have permanent vision loss. There is a condition which is called retinopathy of prematurity. For all children that are born prematurely, it is important that they have an eye examination done by an ophthalmologist to check the retina and the development of the retina right at the time of birth. Following which, if the doctor notices that the retina is not developed, they may require repeated eye examination, and at the same time, they may require some intervention in the form of eye laser in order to treat the retinal issue. So, if your child is a premature baby, he would require an eye examination even though he's admitted in the NICU. In the recent times, the retinopathy of prematurity is having a lot of importance because if we catch it early and treat it early, we can prevent permanent vision loss or blindness in these children. During a baby's first month, their central vision is still developing. A newborn baby can see. They are still forming the connections between the retina and the brain. So, as the central vision develops, a baby may begin to focus on an object that is dangled right in front of them. Because their vision is not very sharp, they can only see things that are very close to them, and most importantly, they will be only following a light or a shiny bright object that is kept dangling in front of them. By the age of 3 months, a baby's eyes should focus and follow the objects. So this is the time that parents should start noticing, and they should start paying attention whether the child is able to follow objects. So they can keep a bright toy or a light, small source of light, and try to move it around the child's face and see whether the child is trying to focus and follow the object. If this is not being done by the child, he requires immediate attention and to be shown to the doctor immediately. By the age of 5 months, babies are seeing in 3 dimensions. That means the babies can start to see better, to reach out to objects, and to see how far they are. Around 9 months, the baby's eyes have turned their final color. So we see a lot of times children may have a little different color of the eyes at birth, but by the age of 9 to 10 months, their final color of the eyes reaches. When the child is a toddler, you should watch for misalignment of the eyes. You should see whether both the eyes are looking straight forward, or is there any inward or outward, upward or downward deviation of the eyes. This is what we call squinting or strabismus. So this is important to be noted and picked up. If the children have their eyes which are not straight on and their eyes are being deviated, they require immediate eye checkup. Most importantly, with this checkup, we have to see whether the child is having any eyeglass power, in which case, giving the glasses would help them improve the eye squinting. And if at all it is not a power related issue, they may require a surgical procedure to correct the squinting. Squint surgery is not just a cosmetic procedure at this age. This surgery is required to be done in children in order to prevent a permanent damage in the form of lazy eyes, wherein the child's eye stops seeing, and this can lead to a permanent problem in children, which then at a later age becomes irreversible and a very difficult issue to be treated. So if you are seeing a child who has got any deviation of the eye, it is important to have the child examined immediately, and a corrective measure has to be done as soon as possible. There are very important, not so obvious signs in childhood in order to note whether the child has got any vision problem. Children are most interested in activities like television or some cartoon being played in the mobile. If you take the child a little away from the screen and if he stops showing interest in that object, then you have to really think that the child is possibly having a poor vision from a distance. Again, if you are trying to close an eye of a child and he starts feeling irritable, it is important to note that possibly that eye is the only seeing eye in the child. A lot of times, children may not be seeing with one particular eye and may be having a good vision only in the other eye. And if by chance you close that eye, the child will start getting irritated and would really not be comfortable. Also, if the child is losing your place when reading and turning your head to look at something in front of you. So these are important things. The child is not able to see straight on. If he has to turn his face, if he is not having proper field of vision, these are important things that have to be noted. Along with that, it is also important to note that click photographs of a child with a bright flash on of the camera. There is something known as a red cat eye reflex, which is normally present in all children. That means the eyes shine bright and red. But in case the same shine is turned into white, this is an important sign to be picked up, which means that the child is harboring some disease in the child's retina, and sometimes this may be a very serious problem in the form of an eye tumor or a cancer, which is called retinoblastoma, and this requires immediate treatment, else it can spread and even become life-threatening for a child. Most importantly, once children start going to school, and with the present time wherein a lot of schooling and education is online, parents have started feeling that the digital eye strain is becoming a big problem. A lot of people have started trying to resort to blue cut glasses. However, it is important to note that in the modern screens, the blue light filters are pre-existing, and the blue light from these digital devices are not dangerous for a child's eye. But it is important that you should limit the screen time of the child and try to avoid any screen time later in the later part of the day, and encourage that the child moves around, moves out in the open to play during the evening hours so that they have a proper sleep. Most of the development of the body of a child happens while they are sleeping, including the growth, memory consolidation, and the development of the brain. All of it happens while the child is sleeping. So, if the child is exposed to screen, especially during the later half of the day, there is a decreased chance of a proper sleep, and sleep problems do arise from the blue light. Blue light do not otherwise damage the eyes, but they affect melatonin in the brain, and this is what keeps the child awake for a longer time. So there should be no dinner time screen, no dinner time television. You can sit together, encourage child to talk, to read a book, especially in the evening time. See to it that they run around a lot in the evening so they get tired and they are able to sleep well in the night time. Most importantly, if somebody says that blue light protecting glasses are important, try to skip this claim. These have no definite scientific basis to them. And if the child has a glass power, it is important that they wear the correct glass power, but not required to have any blue filter in the glasses. Again, important thing that parents are always worried about is what is it that the child should be eating in order to have a good eyesight. So what does a nutritional rich diet look like for children? So a good colorful plate is what is important to have for children. What is important is the diet should be rich in vitamin C. And luckily, a lot of these products that are required for the eye growth are there in vegetarian diet also. So you can have child should be taking oranges, strawberries, tomatoes, red and green peppers, broccoli, grapefruit, kiwi fruit. These are all very good sources of vitamin C. Vitamin E is quite commonly seen in your almonds, sunflower seeds, olive oil, avocados. Zinc is very commonly seen in legumes, seeds, dairy products. These are all good sources of zinc. Again, a very micronutrient which is important for the retinal development, the retinal strength, is called lutein and zeaxanthin. So these are naturally found in your retina and they help the light sensitive part of the retina develop. So colorful vegetables and fruits like kale, spinach, broccoli, asparagus, papaya, peaches, mango are rich sources of lutein and zeaxanthin. So giving all these things, assimilating them in the child's diet is what is important in order to have good and healthy eyes. Again, important thing that has to be understood is what should be the screen time that is appropriate for children. So any child that is less than 18 months of age, it should be completely avoided to have usage of any screen of any sort. Do not expose them to screen as far as possible. Only if required, say if the parent is away and you want to do a video chatting with your child, that is the only permissible screen time for young toddlers. From 18 to 24 months of the age, the screen time should be not more than an hour in a day. 2 to 5 years, again, limit your screen time to an hour, and most importantly, pay attention at what the children are trying to see. 6 to 12 years of the age, again, try to consistently limit the spend time with media and try to have the children take a lot of interest in physical activities, because it is quite often seen during this lockdown period that children have started losing interest in physical activities. Parents are scared to send them down to play with our children, and we are seeing a very high rise in childhood obesity during this period of time. So it is important to encourage children to go out, run outside, play in open air. This is important also to decrease the eye power number and to decrease the chances of getting myopia or a minus glass power or having a nearsightedness. Why? Because once a child is exposed to moving out, their main object of focus are distant objects. So their eyes will be adapted and will be tuned to having a good distant vision. So encourage children to move out, play out, and to see a lot of greenery around them. These are important things that the parents should be noting. If the child is having squinting, it is important that the child has an eye examination performed for him, and you may require to treat it with appropriate glasses. If the eye is a lazy eye, you should importantly see to it that the better eye is patched and you are helping the child see with the lazy eye. This encourages the laziness of the eye to decrease. If you want, we can take some questions.
Yeah, Dr. Ashar, a couple of questions here while you are on the issue of children and reading the books.
Yes.
Generally, we see some of the children maintain a far distance between the book and their face. And some of them are almost going inside the book. The distance between the book and the face is very less.
Correct.
So when they are reading, what is the optimum distance that has to be kept between the book and the face?
So around 16 to 18 inches is what is a reading distance. Okay. If you're looking at more than that, that becomes an intermediate distance. The child is going very close to the book to read. You have to see to it that get an eye checkup done. Not a myopia, where the child has got a very high minus power or some minus power, which is helping him have a good near vision. But the distance vision is what is hampered. Okay. Most importantly, whenever the child has got an eye checkup to be done, it is important that you get eye drops in form of dilating eye drops put in the child's eye, and then get the number checkup done. Because eye muscles in children are very active. If the child is to have a plus power in their eye, the eye muscles contract and they hide this plus power. And that is what leads to a lot of strain in their eyes. And quite often, children also complain of headache. They lose interest in seeing objects or reading after some time because the eye muscles start getting fatigued. So it's important that you get a proper eye examination after having put dilating drops. So don't rely on opticians to get an eye examination done in children. Try to see a doctor who would do a complete eye checkup after putting the drops in children.
Okay. And this distance of 16 to 18 inches that we are talking of, does it remain the same when you are viewing digital devices also?
So that becomes a little intermediate distance, so that can take a little more than this because you are having an intermediate distance. Right. And most importantly, there you can actually change the font in order to adapt things to your visibility.
Okay. And these days, when there is a lot of screen time by the children and even by professionals, do you recommend anti-glare if someone is using glasses? Do you recommend the anti-glare coating or UV coating?
Most of the screens today, the modern screens, have an inbuilt UV filtration or blue light filtration. So you do not require any additional blue cut glasses for these things. Yes, you can have, if you are having a lot of glare, if your room is such, your screen is having a lot of glare coming to it, then that is what needs to be addressed to. You can actually try to cut that glare. That is what is important than having a coating on the glass or on your screen.
Okay. And one question which I'm very sure a lot of parents of teenagers will relate to. These days you have Samsung and Google coming out with wearables, especially for virtual reality and augmented reality. And a lot of kids spend so much time using the VR glasses to see a movie or watch a game or do other activities. Are these harmful for the eyes? Should the exposure to these kind of devices also be limited?
Yes. Most importantly, if you're watching a movie and if it's for constant 3 hours, so that is a very close watch for constant 3 hours, and that goes beyond a permissible constant screen time for any individual.
Okay.
So again, since you are going to be looking at a VR device constantly, your blinking would be very less during that period of time.
Okay.
Instead, it would be advisable to watch the same thing on larger screen, which would be beneficial, less strenuous. Especially for children or young adults who suffer from migraine, a lot of them don't tolerate these VR devices as well. They'll end up getting a migraine headache also with these devices. So you have to understand these limitations that you may have before you want to go with these.
Okay. Doctor, there have been a couple of requests that they are unable to hear your voice loudly.
Okay.
So maybe you could either increase the volume of the mic or be a little closer to the mic.
I try to be a little closer to the mic also and try to increase the volume. Both of it. So
thank you, doctor. Please proceed.
Yeah. So now let's move ahead to younger adults. And today, like what we were discussing for children, what is common, and that is something that you're getting right now, is constant use of computers. Though the information technology and computers have really kept us together even during this pandemic, wherein a lot of us would have either not been able to work at all or would have been really depressed or isolated had there not been computers and internet with us today. It has got its own problems. So constant use of computers, constantly sitting on screens is what leads to something that is called computer vision syndrome. And this has a wide array of issues that a person faces, right from burning sensation, redness, dryness, tearing, neck stiffness, neck pain. Just excuse me. Neck pain, shoulder pain, headache, backache, blurring of vision, double vision, poor vision, and slowness of your focus change. All these combined actually what forms what we call a computer vision syndrome. And most importantly, this is what affects almost every individual today, because all of us are today glued to our screens for almost 8 to 10 hours minimum. And we all have to keep working on the system throughout the day. So what's important? How do we prevent this? So most importantly is to take multiple breaks while you're working with the system. A 20-20-20 rule is what really helps us the most. So every 20 minutes, take a break for 20 seconds where you look at an object that is 20 feet away. Wear your proper glass correction. Most importantly, see to it that the lighting is ambient and proper in your room. Try to have minimum glare when you're working. If the light is directly being focused on your screen, see to it that the glare is minimum. Adjust your distance properly to 40 to 76 centimeters. Keep blinking very frequently. That is what is the most important eye exercise that you can do. Blink as frequently as possible, because when we are working on the computer, we tend not to blink. Have a proper distance, have a proper angle. See to it that you have a good backrest. Don't hunch constantly when you're working on the screen. Your screen has to be on a proper direction. Have your hands in a proper way when you're sitting on the desk. You can have a footrest, have a proper height of your desk, because all of these are important in order to avoid any issues related to your eyes, your back, and your neck muscles. These constantly having screen time also leads to a problem that is very commonly seen in younger individuals, which is called dryness. A lot of times people, and as we keep getting older in age, the tear film, which is what is formed to protect your eyes, And this starts getting disturbed and we start feeling dryness in our eyes. Again, certain medications like antihistaminics, antidepressants, they also tend to lead to dryness in your eyes. Also, medical conditions like Biobr syndrome, which is like an arthritic condition, thyroid problems, they also lead to problems of dryness. Constant screen time, again, sitting in air conditioned rooms where there is very low humidity, they also lead to dryness. And most importantly, we have some glands in our lid margin, which are called Biobr glands. And these are what secrete or oily secretion, which helps the tear film from being, preventing that from being evaporated. So, a lot of times it is seen that an improper lid hygiene or because of certain other issues, these glands get blocked and that leads to dryness. So, what are the common symptoms that a person feels if he is having dryness in their eye? So, people may feel that there is stinging and burning sensation. There may be sandy or gritty sensation in their eyes. Occasionally, people will start feeling blurriness. There may be redness in the eye. And because of the inflammation that sits in the eye, the body starts producing excessive tears. So, you can also have tearing from the eye. So, you would be really confused. If my eyes are dry, why am I crying so much or why am I tearing so much? So, dryness does not just mean poor tear amount, it also means improper amount of solutes or poor quality of your tears. So the dryness is both lesser amount of tears and also it depends on the quality of tears. And in today's time, what is important is an entity which is called mask associated dry eyes. So the air from breathing out is channeled up to the top of the face over the surface of the eye. And this leads to tear evaporation. And over a period of time, you start feeling dryness in your eye. So this is what is a very important entity today. People are wearing masks throughout the day. They are more prone to dryness. So in order to avoid that, you have to ensure that your mask fits you well. And if there is a lot of air that is moving up, try to tape your mask using a micropore tape. You may use lubricating eye drops and you may limit your time in the air conditioned room. Again, it is important to avoid touching your mask again and again. Avoid touching your eyes, your face without unwashed hands. Now, once you are having a problem of dryness, it is again important that you should be able to treat it. There are multiple remedies that are there that you can do. Simplest forms being what you can do even at home in terms of environmental changes. Try to hydrate yourself more. If there are certain medications that are leading to dryness, ask your doctor if you can discontinue them. Use lubricating drops. If there is a lot of inflammation, your doctor can prescribe you anti-inflammatory drops. If the fat glands in the lid margin are blocked, have a good lid hygiene by cleaning your lids properly. Use warm cloth to keep on your eyes. This leads to increased secretion of your Biobr glands and prevents the dryness and decreases the tear evaporation. So, to summarize, if you are having the symptoms of dryness, see to it that you treat it on time because sometimes this leads to even permanent vision loss. Again, second important issue that you see in people who are above 18 years of age is glass power. And a lot of them want to get rid of their glasses. So basically, what is it? What we call ametropia or having a glass power in your eye. So what happens in your eye? Basically, your eye works like a camera system. So there is a cornea which is right in front of your eye. There is a lens and it focuses light that comes from infinity or from faraway object and falls onto your retina. And this is what leads to a clear image that is then transmitted to your brain, and this is what you perceive as an object. So when the eye size is bigger than normal, what we call myopia or nearsightedness, or a person with a minus eye power. People, if their eyeballs are small, will have hypermetropia or a plus glass power, or they are called farsighted. Then there is something known as cylindrical power, wherein the curvature of your eye is not proper, and this leads to scattering of the light, and what you see is a cylindrical power or astigmatism. So these are the different types of glass powers that people have. And basically, having glasses is not just an issue in terms of numbers, but it also sometimes is a disease. Like most of the diseases have a treatment, having a glass power also has a medical treatment for those who are suitable to undergo in form of a laser eye surgery or lasik surgery. So this procedure is basically done on the front part of your eye, which is called the cornea, wherein we shape it in a manner that the light rays which otherwise are not reaching the retina start reaching it. This procedure is a very sophisticated laser procedure wherein using specialized machines, we slice your cornea and make a flap of the cornea, give it a laser light and put the flap back. So in external appearance, your eyes don't change any which ways, but the light rays, which were otherwise not falling on your retina, start to fall on your retina. So who are the people who are suitable to undergo this procedure? If you are above 18 years of age, having a stable number for at least 6 months, having a myopia of less than 10 diopters, a hypermetropia or plus power of less than 6 diopters, a cylindrical power of up to 4 diopters, and not pregnant, not on any other systemic medications, can undergo this procedure. For a lot of people who have even a power of higher than 10 or plus 6, they are the ones who sometimes feel that they may not be able to undergo this procedure. But there's something else that we have to offer for them, which is what we call an ICL. Like people wear contact lenses, there are these medically formed lenses, which are called ICL lenses, which are implanted inside the eye above their natural lens, and these help people to have a better vision. So basically, people who are wanting to get rid of their glasses have an option using sophisticated technology to decrease their glass power and to get rid of their glasses permanently. So these help in people, helping them in order to see clearly without wanting to use glasses. Not only this helps in improving their vision, their quality of vision, but also for a lot of people in their professions. A lot of people who want to have professions in merchant navy, in aviation, in contact sports, these procedures help them in order to see clearly and help them also to achieve their professional goals. If there are any questions with regards to this age group, I'll be happy to take them at this moment.
Yes, doctor. A couple of questions here.
Yeah.
Is LASIK eye operation totally safe, or are there any kind of side effects which are possible?
Yes. So most importantly, you have to have a thorough examination of your eye in order to understand that you are a suitable candidate for this procedure. Not everybody can have this procedure done on their eyes. So there are specific criteria which we see, and if you fulfill each one of them, it's only then you undergo this procedure. If you're not suitable even for one of those criteria, you do not undergo this procedure. Post procedure, regarding the complications, usually if the criteria are fulfilled very well, the chances of complications are negligible.
Mhm.
Some people may still have a little glass power, which they may have again after the surgery. However, this is extremely rare to have.
Yeah.
The commonest thing that people face in the initial post-operative period is dryness of their eyes, which can be taken care with lubricating drops, and it's quite often a very transient thing which goes away with some time.
And one who gets a LASIK operation done, is the vision that is restored equal to the original eye vision, or does it come with some conditions?
It is equal to what they have post with their glasses. If a person is having a lazy eye,
yeah,
so you cannot improve that with LASIK. Okay, so only you can restore the vision to what they see with their glasses. So expectation should be realistic if you're planning to undergo this procedure.
And it's good that you mentioned that people in sports do get the LASIK eye operation done.
Yes.
We used to read about Tiger Woods winning almost 56 PGA victories. And sometime in 2008, I believe he got a LASIK operation done, which helped him better his eyesight. But what is being said is Dr. Witten, who performed the surgery on Tiger Woods, did it in such a manner that instead of a 20/20 eyesight, which normal people have, his eyesight got better to 20/15.
Yes.
So I believe, yeah.
Sorry.
So I believe there are a lot of golfers who do it, and especially people who are playing outdoor sports where they need to have a longer length of vision who do this. So is that possible to better your eyesight than the normal?
Yeah. So it's not just the quantity of vision; it's also the quality of vision that can improve. Because today we have something known as customized LASIK options, wherein we also look into functions of the eye beyond your numbers in terms of something called as aberrations. So these are what determine the quality of your eye vision.
Okay.
And once we correct the aberrations that are dangerous for your eyes, your vision quality as well as quantity can become better than normal.
Okay. And there are a lot of people who have major differences in eye numbers in both their eyes.
Yes.
So is that a normal thing, and why does it happen? Why is there a change in number in both eyes?
So what you are saying is medically called an isometropia, wherein there is a difference in the power of two eyes. Okay. So this is a possibility with as a developmental issue with people. Okay. So if this anisometropia is more than 2 to 3 diopters, people have a very poor depth of focus. Okay. So their stereopsis, what we call a depth of focus or three-dimensional vision, is quite poor in those cases.
Okay.
So in those cases, sometimes if the difference is very high, they may not be even able to tolerate glasses well, because glass power in one eye being high and lower in the other eye is very difficult to tolerate for individuals. In such cases, LASIK becomes a medical treatment for those cases.
Okay. Thank you for the clarity, doctor. Please proceed.
Yeah. So now moving on to different age group and aging eye diseases. So the commonest thing that we start seeing post 40 is called presbyopia, or having to require glasses for reading. So this is basically an aging issue which all of us are going to face. So once we start aging, the eye muscles which are otherwise contracting and helping us have a good near vision, they start to fatigue, and you start to have problems with your near vision, which requires an addition of plus power in your eye. So presbyopia is a very common condition that all of us face, and this starts right from the age of 40 and can sometimes be seen even a little earlier by 30, 38. People who are having a plus power in their eye, originally, they have presbyopia much earlier than people who have minus power in their eye. And gradually, as you age, this power keeps on increasing. The treatment is in the form of glass correction. So you would require bifocal lenses or trifocal or progressive eyeglasses. And these are required to be doing your near and intermediate activity. However, a lot of people want to have a procedure done on their eye so that they can help get rid of these numbers also. So you have multiple options even for such people. Most commonly performed is a presbyopic LASIK. However, it is important to note this is a very temporary procedure. Because if you're trying to do a presbyopic LASIK, you are only creating a multifocality on the cornea. But as you age even more, your power of plus increases, and you can only correct what is there at that particular age when you're undergoing the procedure. There is another treatment in form of corneal inlays. They are called corneal rings. So these can be put in the layers of your cornea, and these sometimes help us have good near vision. However, these procedures are not very common and quite often have only temporary results. So there's another procedure which is what we call prelex or clear lens extraction, wherein, like a cataract surgery, we would remove the crystalline lens from the person's eye and implant in another lens, which then takes position of your natural lens. And these lenses can be lenses that have progressive power in them, and they will help you see for both near, intermediate, and distance. This becomes a procedure. The second common thing that people have at this age is cataract. So what is cataract? Like I told you, each one of us has a lens in your eye, which is crystalline and clear once we are young. As we grow older, the proteins in the lens start becoming a little hard and it becomes opaque. And that's when we start seeing things blurred. The earliest sign of cataract is improvement of your near vision, and most importantly, decrease in the low light or night vision. So especially people who are used to driving at night, they pick this change up very early. So if you are developing a cataract, you may not just have a poor vision in terms of vision with glasses, you may still see things clearly. But now the first thing that you may start noticing is that at night time when you're driving, your lights that were tolerable to you start becoming not tolerable. You may start seeing halos around the light. Your low light vision is poor. You require little brighter light to read things or to see things. And this is what is attributed to cataract commonly. So cataract no longer requires for it to be matured in order to get operated. The treatment for cataract is only in the form of a surgery. There are no eye drops that can help you treat cataracts. There are no oral medications that can help you decrease the cataract or for the cataract to go away. There are no Ayurvedic medicines. The definitive treatment for cataract is a surgery. It is a commonest performed ophthalmic procedure and a very safe procedure and gives instant results. In today's time, we have exploited the artificial intelligence to this procedure maximally. We have sophisticated machines wherein we can scan through the whole eye and predict the outcomes in terms of your vision, in terms of your residual number after the cataract surgery, and help you have excellent vision that you had during your teens after the cataract surgery. We can actually predict how your post-operative visual outcomes would be, help you have minimum glass power after the surgery by selecting appropriate lenses in your eye. So today, cataract surgery has moved on from being a manual procedure, from being what was very commonly performed till few years back, which is called phacoemulsification, what normal people thought was laser, to actual laser cataract surgery, which is done in a robotic manner, wherein we perform all the steps, major steps of the cataract surgery using sophisticated machines with minimum human intervention in order to increase the predictability, the accuracy, and outcome. So if you're having a cataract, you have basically two options. One is what do a manual phacoemulsification, and second is what they call robotic cataract surgery and laser cataract surgery. Important to understand, cataract gives us an opportunity to enhance our vision, to decrease dependency on glasses, and most importantly, enjoy a good night without glasses. So you basically have three steps in cataract surgery. One is to accept the cataract, and to remove the cataract, remove the cataract, or is to replace the lenses. So we can have choices when we are doing this surgery. One, called cataract using phacoemulsion. What happens when you make cataract? This is the cataract. There is a lens inside your eye which has to be removed out. So we make an opening in that. So this opening, when you are doing a phacoemulsification manually, can be performed with the guided surgeon with his hand. Or secondly, the same thing can be done using laser. So when the surgeon is performing this manually, in a manual cataract surgery, we use blades in order to make these incisions. So we can make them appropriately. And also there is the cataract is the bag, which is placed inside in your eye. So we have to make an opening in the bag just to be made round. So usually the surgeon performs this with a special instrument which is called an axis forceps or the movement. This has to be a round structure. But you have to understand, if you are told to draw a circle, even if you draw 100 circles, it may not be exactly round. In order to have this step being perfect, today we have a robotic cataract surgery option available with us. So your openings in the eye, the circular opening in the lens, these are all performed using a robot. So a robot makes a proper opening in your lens of a proper size, which is perfectly circular, so that you can have the alignment of your lens right at the center, with a proper overlap of your lens, so it is margin. The second step of the cataract surgery is basically removal of the cataract. Now that you have made the opening of the cataract, previously what we thought of the laser cataract surgery was basically ultrasound. So this is what normally called phacoemulsification. The cataract is cut into small pieces using phacoemulsification or ultrasound energy, which is then taken up or sucked into a special probe using fluid or water currents, and the cataract is removed into small pieces. However, if you are trying to break this cataract, the ultrasound energy gets dissipated within the eye and can sometimes lead to a little injury to your cornea or little burn around that area. In order to minimize this, using the artificial individuals today, we have artificial laser cataract surgery, which is done in a robotic manner, and using robotics, we can actually cut the cataract into small pieces using laser energy without having any probe or any instrument inside the eye. The laser actually passes through your cornea and cuts your cataract into small pieces, which are as small as few microns. So these small pieces can then be sucked out like using a straw kind of an instrument, using a small opening. These pieces of cataract that are made into your eye using laser can then be removed from the eye without using any energy, thus protecting any collateral damage to your eye and having a very, very safe surgery on your eye. So using a robotic technique, we can actually decrease the energy that is required into the cataract, making the surgery faster and at the same time much safer in your eye. So while removing the cataract, we have two options again. Either we do a phacoemulsification or a laser cataract surgery. The third step of the cataract surgery is called a removal kind of implantation of the lens. So after having removed the cataract, we put another lens on your eye, which goes and takes the position of the lens. Lenses are different types. So there are lenses which are called multifocal lenses, which helps you see better for all your range of vision. So if you have a cataract and wish to have complete removal of your glasses, you can choose multifocal lenses. Cataract surgery in today's time is an extremely safe procedure that does not require any injection, any patch or black glasses. You can resume your normal activity, including activities like reading, watching television, cooking, right from the same day of the surgery. So it becomes a simple 10 to 15 minutes procedure, helps you enhance your vision and helps you see better. A second common aging problem is glaucoma or JAMA, which is an important blinding condition which happens because of increase in the eye pressure. Like all of us have blood pressure, there is an inherent pressure in our eyes. When this pressure increases, we have a condition which is what we call glaucoma or increased eye pressure or JAMA. So this pressure keeps pressing your eye nerve and this leads to decrease in your side vision. So what are the risk factors for people to get glaucoma? Most commonly, a family history of glaucoma in your first degree relatives, diabetes, being nearsighted or having a plus eye power when your eye is small, long-term use of steroids, and an age above 40 years of age. So, what are the symptoms? Unfortunately, unless glaucoma becomes very severe, it is a silent disease and most commonly picked up on a routine eye checkup. However, in extremely serious cases, people may have pain, they may have redness of the eye or blurred vision. But these are very rare to have. So what does glaucoma do? It basically starts decreasing your field of vision and you stop seeing things from the corner and your vision is only a tunnel vision that you see right from the center. And whatever vision field is lost in glaucoma is never regainable with any treatment options. So prevention of these problems is what is most important, to have an early diagnosis of glaucoma and more importantly to treat it on time with medications or surgery so that future damage is what is prevented. Third common problem that you have as an aging is diabetes associated eye issues. So diabetics leads to three major problems in our eye: an early cataract, glaucoma, and third and most important is a retinopathy. Our retina is a structure which has blood vessels, and this is what connects your eye to the brain. In diabetes, the blood vessels in the retina start losing their strength and the blood starts to leak out of those. So once the blood leaks from there, it gets into the cavity that is there in the eye, you start seeing bleeding on your retina and swelling on the retina. So you start losing your vision and new vessels start forming on your eye, and this is what leads to permanent vision loss. So people who are diabetic require a very frequent eye checkup almost every 3 to 6 months for the retina. Even if their vision is normal, they can still have retinal changes which can eventually lead to permanent vision loss. Treatment for diabetic related retinal changes includes lasers on the retina, some injections which are required to decrease the bleeding, decrease the swelling on the retina, which have to be given on monthly intervals, 3 to 5 injections are required, and a constant monitoring and most importantly, control of blood sugar values and their HbA1c values is what is very important, and a tight control of the diabetes is paramount. So it is important for us to note that as we age, we have to take good care of our eyes and most importantly, prevent any blinding complications. I can take few questions on this if there are any.
Yes, doctor. Very clearly and lucidly explained cataract. You made it look so easy and so interesting also. I remember when my grandmother got operated for cataract somewhere in the 1980s. The surgery, she had to stay in the hospital for about 3 days, and then there were 3 months of restrictions. And before she could get back to her normal lifestyle, it was almost 4 to 6 months. And now I think you've reduced that period to hours. In 4 to 6 hours, people are back in their offices. Why so much of difference has come in the cataract surgery? People used to end up with soda bottle glasses earlier, and now they come with very thin lenses or sometimes no glasses at all. So this is how much I believe that technology would have improved. A small trivia here, I believe the glasses, they say, were invented in the 13th century. And from glasses to the kind of spectacles that we use now, it took us about 400 years to move to that. From these glasses to contact lenses, it took us 200 years. And from the contact lenses to LASIK, it took about 30 years. So what do you expect in the next 10 years? How fast do you expect technology to change, and what is to come in the next 8 to 10 years?
So we are advancing a lot when it comes to the intraocular lenses that are implanted at the time of cataract surgery. So initially, when we used to have lenses that were only available to be put in an anterior chamber, which would later on have problems to the cornea, then we started having lenses to be put in the posterior chamber, which are quite safe. But however, they wouldn't help you get rid of their glass power completely. Then we developed lenses which would correct the cylindrical power, which were called toric lenses. Then we had bifocal lenses which would correct the near and the distance power. But today, with the increased use of computers, people require intermediate vision, which has to be good. So we started having lenses which correct your intermediate vision also. So they become trifocal. Then there were combinations of trifocal, bifocal, and the cylindrical corrections, which was called toric multifocal. And today's time, we have something which is called extended depth of focus lens, wherein you constantly see throughout the range of vision. So if you're like, it's like a continuous zoom that you're having. So there's no step. So it's not that I'm having a good vision at this step, then another at this step. It's a continuous zoom. So this is what we call as a newer technology, wherein we are seeing. Now, along with that, the new things that are being worked on, like you told in LASIK, to enhance the vision to have better than 20/20 vision, is to correct even aberrations. Okay, so we are now trying to have lenses implanted in the eye, which along with the number correction also would correct the corneal aberrations in order to have better quality of vision in the people. Longevity has improved drastically. People are living much longer. Their active, productive years are much longer. With computer usages, or people are working even till their 70s very actively. So they want good quality of vision. They want to enjoy sports even at an elderly age. So the demand is more. So the technology is now actually moving towards improving their vision quality, having them have as much lesser dependency on glasses as possible. At the same time, the surgical technology has improved so much that we're trying to reduce the recovery time to just a few minutes to an hour. So it has become just office procedure. You just walk in during a lunch break, go back to your work. So it is getting as advanced as we can think of.
I think we are slowly moving towards customized eyes.
Yes.
Please continue, doctor.
So really having understood all the eye care that happens throughout our life, it is really important to note that now that we have come to this world, we have to accept the most important reality of life, which is death. And all of us who have come here are going to go one day. But what we can leave behind as a legacy, along with a good name, a good fame that we have, is important as that we leave behind our eyes for somebody to see. Fortunately, as a Gujarati, as Bhatia community, we have always been in the forefront in order to have this eye donation thing moving on ahead. So it is important that we pledge our eyes for people to know that we are interested in having our eyes donated after we are gone. Eye donation is an important noble thing, and it really does not take away time of the family. It can be done within the first 6 hours of the death. It takes only hardly 10 to 15 minutes. Does not lead to any scar or disfigurement of the face, because no longer we remove the whole eyes, we only remove the cornea, and that is what is used for transplantation purpose. And if you are donating eyes, you give sight to 2 to 4 people using one pair of corneas. They are not sold or purchased. They are basically used as a noble cause to be donated in people so that they can have good vision, they can have good eyesight so that they can keep seeing. So basically, eye banks are organizations wherein we collect corneas, evaluate them, preserve them, distribute them, depending on the waiting list to patients who are requiring cornea transplantation, improve public awareness, have good research regarding cornea transplantation, and most importantly, process them. So, like we have eye hospitals, I, as a cornea transplant surgeon, I am trained in doing cornea transplants. I also am a medical director of one of the eye banks, which is called Sayara Eye Bank, which is also formed by Kachis. And this eye bank is a large volume eye collection center in the state of Maharashtra. So here we have eye collection. Along with that, we do processing of the corneas. We have a proper distribution system wherein we are collecting the corneas, which then go to the eye bank, then go to the eye bank tertiary center, wherein it is processed and then distributed to various donors. So I would have one request to all of us.
According to the
that
World Health,
whenever we are having a small program in our family, a birthday or an anniversary, and we are trying to do something good for the society, our friends, family members, just remember one thing, that there is somebody who cannot see your program, your function, the match that you enjoy, a cricket match that you are really enjoying with your family. There are people who cannot see these things. So before spending on a program, and if you are fortunately well to do, try to sponsor one surgery on your birthday or on your anniversary for somebody who is less fortunate, who cannot see this world. It can be any eye related procedure. We have a lot of our patients who come forward and help us do transplantation for patients who are not affording, who come from rural setup, who come from faraway places, farmers who are very poor. And it really helps us see the happiness on their face after they regain vision. And even for people who have helped these people, this is something that is very important. This is a small video I would want to share with you all,
Organization, corneal blindness is the fourth
which is a
leading cause
reality in
of
India.
global blindness. Of the 45 million blind people across the world, 15 million live in India. Surprisingly, 75% of these cases are curable. In India, blindness has devastating effects on individuals, families, and communities, impacting education, economic development, and child mortality rates. On an average, the country needs 250,000 corneas in a year, and only 24,150 are collected. Out of these, 54% of the eyes do not meet the standards for transplantation due to the lack of technology and medical expertise. One such family lives in the drought-hit district of Maharashtra, Latur. Atul, a blind cricketer who met with an accident when he was just 5 years old and lost his vision. Due to their unfavorable financial circumstances, they were unable to provide him with the required medical treatment. But this did not demotivate Atul. He plays cricket at the domestic level and is a very good batsman. It was at a charity cricket match where he was diagnosed by Dr. Jatin from Mumbai Eye Care, who believed that Atul could see and helped him in fulfilling his dream of seeing what he loves so much, a live cricket match. Mumbai Eye Care, founded in 2012 by Dr. Jatin Ashar, performs an average of 300 plus corneal surgeries in a year. Last year, out of 330 surgeries, 111 were performed for the underprivileged. Mumbai Eye Care is very grateful for the constant support provided by the patrons who have believed in us. On your special day, don't just blow the candles. Bring light to someone's eyes. Sponsor a cornea transplant and let them enjoy the gift of.
So please help others to see them. This world is a very beautiful place. Help spread light. Encourage cornea transplantation, encourage eye donation, and we can really help the whole world see much better. And a lot of people live their life independently also. Thank you very much.
Dr. Jatin, especially about the eye donation, I think that's a very noble thing, and being involved in it in such a way, hats off to you. And also hats off to the lakhs of people who would have supported this movement by by donating the eyes of their family members. We also had a couple of questions which had come in, Doctor. So I would like to ask you that. Uh, I had a question from Dhaval that if the retina is not developed properly before birth, or it is developed or it is damaged later, is there any possibility to rectify this vision?
See, what he's asking is something called a retinopathy of prematurity, which is quite common condition of children who are premature deliveries. In such cases, you have to examine the child so that you can actually prevent devastating complications in the form of blindness. In those cases, we can actually do a laser treatment to prevent new vessels from developing to the cornea, and at the same time we can help the vision being restored. If it leads to retina detachment, we can do surgical procedures so that we can prevent blindness in these children also. However, if the retina gets completely damaged, it's not possible to really restore vision in these patients.
And there are talks about stem cell therapy which are going on, especially when a baby is born, they collect the stem cells for use later on. Do these also have some significance in taking care of eye issues or any deficiencies which may occur at birth, which can be rectified later using the stem cells?
Stem cells in ophthalmology have a good role when it comes to limbal stem cell transplantation. Okay, so limbal cells basically are cells that are around your cornea. The only definitive stem cell therapy in ophthalmology that is working in today's time is the limbal stem cell transplantation. Retinal stem cells are still being evaluated. They really till now have not had any definitive role whatsoever. Limbal stem cells basically are useful in conditions such as chemical burns. In India, we see a lot of people who get injury to their cornea because of tuna packet injury. Tuna is a very common thing that we see, which comes in small packets. A lot of times we see all they come in small tubes that people who take tobacco use. If a child lands up having access to that, you've seen that the tuna just goes and gets into their eyes, and this leads to burns in their eyes. Okay. So this leads to permanent damage to the limbal stem cells, and that leads to vessels coming on the cornea, and the cornea becomes white over a period of time. So in those cases, we can do surgery and we can take limbal stem cells from their better eye, if it is only in one eye, or from their relatives, or from a donor cornea, and transplant it to that eye, and that helps them reverse the damage that has happened because of the tuna packet or the chemical injury. However, we still don't have any definite role of retinal stem cells in ophthalmology till now.
Doctor, one more lot of popular question is that are there any recommended eye exercises to slow down the onset of eye issues or to reverse the eye numbers?
Unfortunately, there are no exercises to reverse the eye numbers because it is a developmental issue. Most commonly, the numbers happen because of a change in the eye size. Okay, so you cannot change that. Eye exercises are there in people who have some squinting or deviation of their eyes that go out, wherein what we call is doing convergence exercises. So when we take a pencil tip or a pen tip has to be kept at a distance of around 40 centimeters, and you have to move it backward and forward, concentrating on the tip. When you move it away from you, you will have to see to it that the behind object is single and the tip starts looking double. Up to that point, you have to take it away. Bring it closer to you till you see the tip as one single object and the background starts looking double. And doing this is what we call pencil push-up exercise. And this is what is important for people who have outward deviation of their eyes or people who get fatigued after some time of screen use because that improves their convergence, and these work quite well. Then there are some exercises which are done using softwares for children or adults who have lazy eyes in order to improve the laziness of the eye, to stimulate the eye that has become lazy to start seeing again. So these are the only proven eye exercises. Other than that, no eye yoga or anything else would work for any of the eye conditions.
Mhm. Thank you, doctor. And one fun question, which I think we can end with, that Ms. Ajay has asked that we see cricket players or cricket fielders wearing fancy glares while fielding. So is this only in cricket, or do they actually help the eye, or is it just a fashion statement?
No, it's not. It would not be just a fashion statement that I would say. And like I told you, what is important is the light troubling you, because they are playing in open, and which is what is very important. And they have to like constantly keep running from an area which is shaded to an area that is bright.
Mm-hmm.
This is what keeps happening for them again and again. So it becomes very difficult. They have to look at a ball that is going to come from far off, and if suppose you have to catch a ball and you have to look up, and if you're directly facing the sun, it may be difficult for you to keep your eyes open.
Okay.
Right? So in order to really be able to see the ball and keep your eyes open, you have to wear shades. So it has got its own reason for that.
Thank you. Thank you so much, doctor. The way you went about the whole eye care thing with different age groups and the issues which each age group faces and the rectifications possible. That was, I think, very clear and very easily understandable, and it will be there in the back of the mind for everyone for a long time. Thank you so much for coming for this session, doctor. We really appreciate your time and the knowledge that you shared.
Thank you. If there's
Meanwhile,
any question, you can contact me. I can reply to people on their email also.
There are actually a lot of questions. Some are regarding eye donation, some are regarding, I think, the charges of corneal implants and other things. So that we will email it to you. I think
Sure.
it will be better to be answered on the email rather than on this forum just now, because they could be specific. And maybe we'll also share your details with the people who are asking for it.
Sure. Thank you. Thank you very much.
Thank you, Dr. Jatin. And meanwhile, to all the people who have joined us today, we want to thank you for sparing your Sunday morning and being with us on this session of Drshtikon. For the first time, I think we had a session on Drishti in Drshtikon. And thanks to Dr. Jatin Ashar for being there. Meanwhile, we have a special session coming up on next Sunday. Generally, we have our sessions only on the first Sunday of the month, but this time we'll be having a session on the second Sunday also. So on 10th October, we have Mr. Harsh Mariwala, Chairman of Marico Industries. He will be talking of the growth of Marico Industries, including his book, Harsh Realities, that he has recently released. So please join us for that session next Sunday. It will not be at 11 o'clock as usual. It is from 10 a.m. to 11 a.m. So requesting everyone to join in for that session on next Sunday. Meanwhile, from all of us, the Drshtikon team here, and Meenal Ashar, Khyati Morparia, who are on the screens today, and me, Prashant Morparia, thank you so much for joining. Keep healthy, keep safe,